So far, as we've talked about normalization, we have really focused on the students and helping the students understand and grasp and validate the emotions that are ruminating from this very painful place, from this crisis that has occurred. It's also important to make sure that parents and teachers are on the same page as students. And students understanding other students as well. Sometimes, even though a responder has had extensive training, we really aren't privy to all the ways in which a student at any given age might react to a situation. Sometimes, when a student has experienced a crisis, they may become elevated or very upset over something that we perceive as very insignificant, like a toy, a blanket, or other items. Recently, a teacher was telling me about a circumstance where one of her students, and this is very sad, unfortunately had experienced some very, very hard times at home, abuse-wise, and had stickers on his overalls. And the teacher went to pull the sticker off, and as she did, he became extremely upset. He had been traumatized, and although a crisis had not occurred very recently for this student, that is a great example of a negative or an excessive, really, reaction to the removal, of something that we perceive as insignificant. But for that kid, it was huge because, he cherished those things. He had experienced some rough upbringing, and so that's a good example of post-traumatic stress disorder. Oftentimes, students who are in crises might be very possessive over items, and a lot of that is to seek control. A student's behavior may change from a very quiet and obedient student to a loud or noisy student, and this is also a sign that they are not, or they have not had a chance to grieve or deal with the crisis in a reasonable manner. Parents and teachers may see that students change from very outgoing personality to more shy and afraid or withdrawn. Again, these are signs that a student is really dealing with, you know. Additionally, students may even, demonstrate fear regarding, the anticipation that an event will reoccur in some form. Oftentimes, this happens with, you know, here in Kerbal, we have a 500-year flood. The last time, the 500-year flood occurred, we had, students and families who lost homes, right? No wonder students anticipate those things happening again. When it's happened to you once before, I mean, that kind of sears into your brain. It sticks with you, and it's a very traumatic thing. And so, while it may not be rooted in logic, and it may not be, reasonable in our mind for students to think that way, it really is a reality. When a traumatic events occur, they may think it happens again. I'll never forget, when a good friend of mine from high school passed away suddenly, I got a phone call. And then also, about 2 weeks later, I got a phone call about my grandfather passing away. After that, whenever I got a phone call at night, boy, oh boy, I was anticipating the worst. And I was afraid that there was going to be a reoccurrence of some sort of death. It took a while for that expectation to be distinguished. So, you know, personal examples. As we move through these, if it's hard for you to grasp these concepts, try to draw on your personal experiences. And additionally, you may have students or parents and teachers may see that, or they may observe that their student, their child, becomes easily upset over quote-unquote nothing. Really, it's not nothing, but maybe nothing happened right there in that moment. But you know how it is. Thoughts, feelings, they pop into your head at the least expected moments. And it can appear as though nothing has really occurred to make someone upset. And that would indicate that there are still a lot of crisis response to be done and work to be done with regards to normalization for the student. Still, other students may experience loss of trust in adults. You know, sometimes students, if the tragedy or the crisis involved adults, they may push away. They may feel like adults can't be trusted. Also, increased attachment to parents may occur. So I'll never forget when my son Luke was very, very young. He accidentally, he was hiding in the closet in my wife's classroom, and it automatically locked. So she was out, making copies. He was supposed to be hanging out. Well, he was locked in there, And that freaked him out for a while. And after that, he was attached to our hip, you know, for a good amount of time, and we worked through that slowly. And thank goodness he's not in a place where, you know, he's expecting that to happen again. But I guarantee he'll never go in that closet. So increased attachment to parents, and that was a minor circumstance compared to much of the crises that our students deal with. But it still had a profound effect on my, 8-year-old son at the time. Somatic symptoms are something we can all relate to. It's kind of like that stage fright. When we get in front of, a group of people and we have butterflies in our stomach, or, we're really, really anxious about something and we get that acid reflux or that stomach pain or that headache because we're stressed. Psychosomatic symptoms are prevalent. And when there's a crisis going on in the schools, it's very, very common for have students to want to exit the situation because they feel ill. We've had many students asked to go home, and really they're not suffering from a virus, they're not suffering from some sort of infection, but they're experiencing physical symptoms that are tied to our psychology, that are tied to our thoughts and emotions that we are feeling. So it's important for parents to understand that, if a student is asking to stay home from school multiple days because they feel sick, perhaps they do feel sick, but that is a big indicator that maybe they need somebody to talk to. Of course, nighttime is one of the moments of the day where many of us allow our thoughts to wander. And when you're a kiddo who has experienced a crisis or, heard even about a crisis that occurred with somebody in your school, nighttime is the best time to process these things in the sense that there's nothing else going on, so there's that opportunity. Unfortunately, when we're in our head and we're not discussing it with other people, fears begin to build because we can't process things alone. We can't answer our own questions many times about, what or why or, what next. And so, nighttime is a double-edged sword, and parents and teachers will often note that at night students have some of the hardest time. And of course, increased general anxiety. So if I experience a crisis or a traumatic event, my anxiety is going to be increased overall. And that can look a number of ways. It can look like me stressing out in class over a test. It can look like me being short with my friends socially, not being able to get things done, and really, that is from experiencing trauma at any level. Even if it's hearing about, a student who passes away in a car wreck. As a parent, I all of a sudden become very anxious about my own children driving. Maybe I wasn't connected to the student who passed away, but it affects me nonetheless. Same with students at school. No matter how far removed they are from the crisis itself, they can still experience generalized anxiety.